So the verdict is clear, vaccines work. What about children? Do they need vaccines? Are their vaccines proven to be safe for children? Are countries ready for this rollout? Well, one country is. Israel is asking 12 to 15-year-olds to be ready for vaccination in the next phase. Our next report tells you how the pandemic impacts children and what kind of protection they need.
Masks have come off in Israel. People are back on the streets. The beaches are packed. And friends can embrace without fear. Most adults in Israel have got at least one shot. Next in line are children. Israel is gearing up for the second round of vaccinations. This time, the jabs will go to 12 to 15-year-olds.
Good evening to you. I'm here today after a meeting with the Minister of Health and the health system officials after I reached an agreement with the heads of Pfizer and Moderna for additional supply of 16 million doses of vaccine for Israeli citizens. We are preparing for another vaccination campaign in 6 months' time. Get your shoulders ready and your muscles if you want, and also the kids, because we estimate there will be approved vaccines by then for children.
In other words, Israel is rolling out Wuhan virus vaccines for adolescents. Do they even need them? Are children at risk without vaccines? Here's what we know. Children do not face high risk from the Wuhan virus. This data is from the World Health Organization. Children make up 29% of the global population. They accounted for 8% of all Wuhan virus cases in 2020. Even fewer ended up in intensive care. Most managed to beat fever, cough, and fatigue. Those below 20 years of age accounted for less than 0.2% of the fatalities. In other words, of all the pandemic deaths in 2020, less than 0.2% were children and teenagers. Long story short, they aren't a high-risk group. But do they need vaccines? Yes, they do. Especially children with serious illnesses. Also, children are potential carriers. They can still pass on the virus to adults. So, vaccines for kids makes sense. Do we have vaccines tailor-made for kids? Not yet. Trials are underway to determine how safe the jabs are for children. Israel is waiting from the American health regulator, Food and Drug Administration, to give the nod. Once it's done, Israel will start inoculating minors. They are betting on two vaccine makers, Pfizer and Moderna. Pfizer could be the first vaccine to be rolled out for children. A study has found that the jab is 100% effective in preventing illness among 12 to 15-year-olds. Reports say Israel has given shots to around 600 adolescents in high-risk categories. They saw no significant side effects. The other player, Moderna, began clinical trials on children above 12 years in December 2020. In March 2021, the first group of children was given the first dose. In February this year, AstraZeneca began testing its jab on 6 to 17-year-olds in Britain. And in China, Sinovac claimed that its vaccine is safe on children as young as 3. The company says it has submitted preliminary data to Chinese regulators. Anthony Fauci, America's top infectious disease expert, is optimistic. He believes kids of any age will be able to get a shot by 2022. And it won't happen too soon. For more than a year now, children across the world have stayed away from school. With the virus still in the air, a full return to in-person learning is impossible. Vaccines may be able to give children the protective shield they need to go back to school. But before they get their jabs, the shots must pass the regulator's test. Bureau Report, World is One.
WION is now available in your country. Download the app now and get all the news on the move.